our strategic plan. This process has served us exceptionally well over the past 10 years of the medical school. Our vision to be distinguished as a leader among medical schools through our community collaboration really drives everything that we do. You see this acronym many times of clinicians, leaders, educators, advocates, and researchers adding up to our clear mission throughout the things that we do. Our values and our values in action really drive all the decisions that we make at the medical school. What I'm going to focus on today is really our 6 strategies. And I'll walk through each one of those strategies about where we are and the successes of this past year. Clearly, that has been just really colored a lot by COVID and the pandemic. We started out in early this year with the pandemic declared in March. We formed a rapid response team that has met as often as twice a day. We're now meeting once or twice a week to try to respond, to work through the medical school response to COVID and the changes that we've had to make. A lot of things have happened because of COVID. Our curriculum largely converted to virtual curriculum in March for medical students and many resident events as well. And that's gone back and forth as we can to have more in-person events as well as continuing to have some virtual events. I think that will likely continue for the next 2 or 3 months. We have had to cancel pretty much all of our in-person events in March. We went to work at home and canceling in-person activities before the state actually required this, but now we are consistent with the state's mandates and limiting our activities. And we do have we are not having any in-person events, especially social events, until we're able to get to the point where this can be done safely. We continue to work from home. We have not had business-related travel for the past several months, and those things will stay in effect for a couple of more months. We've had to do a lot of things in the clinic to make sure that we're providing care safely and our frontline healthcare workers are protected and safe. So there's been a lot of things that have happened, and probably an area that's been impacted as more than most has been the occupational health and the additional work and things that they've had to do for both employees and students. So it's clearly, I can't overstate how many things have changed, but I also am very pleased that we've been able to do many things so well, and we've been able to succeed. And despite all of these changes, we've had medical students who have graduated, a new class that started, residents who have graduated, and a new cohort that has started. We've continued to recruit. We've been able to continue to see patients. So a lot of things have changed, but what hasn't changed is that we continue to do the work of the medical school. So let me walk through the 6 different strategic areas. Let me start with medical education. I think one of the great things is that our faculty have successfully pivoted our medical student curriculum and our graduate curriculum to an online curriculum and being able to implement the technology. Part of this was, I think we were well prepared and supported by our IT group to be able to navigate the teams and be able to integrate that very quickly. All of our medical students and graduate students graduated on time. We've had 83 new residents and fellows begin employment in June. We've got new students that started in end of July. Our students did take a hiatus. We were able to continue virtually, but they were able to return to clinical settings in early August. And we are now delivering our medical and graduate student curricula with a hybrid of in-person as well as virtual delivery. Again, I think keeping the trajectory of our students on time has really been a key success of the medical school. Let me walk through some of the measures that we use when we look at how are we doing in different aspects of medical education. One is the first-time pass rate versus the national pass rate for the STEP exam. Step 1, Step 2, clinical knowledge, Step 2, clinical skills. And you can see the results here for our first 3 graduating classes, and we're just starting now with the class of 2021 who's taken Step 1. You can see that compared to the national average, that the medical school has actually done generally better than average. There was the class of 2019 had a little bit lower than the national average for Step 2 CK, but every year you can see that we have done well with our national exams. And I think this is really a testament to the quality of education provided by our faculty and also the quality of students we've been able to recruit to the medical school. But we are doing well compared to other medical schools. I'd say we're above average. Next slide shows that if you look at the graduation rate, we've been in high 89, 95, 90%. The national average for the 4-year graduation rate is about 83%. It's mid-90s for the 5-year graduation rate. While that may seem to be a negative thing to take 5 years to graduate, in fact, many of those students and some of our students have taken 5 years to graduate because they do a year of research or a fellowship year, or they take a year to get an MBA. So there are very good reasons why students will take 5 years to graduate. But as a newer school, obviously everybody in the first class graduated in 4 years. So you can see that we're doing above average and getting students through our curriculum in 4 years. When you look at our match rate for medical students, we've had a 100% match rate, and that's been a real success. When you look at where our students have gone, it's been, I think, a healthy split between primary care and specialty care. So I think we are preparing our students to be able to go into any field that they wish to go into. Our students have matched into very good residencies, very competitive residencies, and very competitive specialties. When you look at how we assess how we're doing with our students, one of the ways that we can measure this is with our graduation questionnaire. Now that's a very long questionnaire, but I boil this down to really looking at what I'll call the money questions. And those are the questions that are, overall, I'm satisfied with the quality of my medical education. I'm confident that I've acquired the clinical skills required in a residency program, and my medical school has done a good job of fostering and nurturing my development as a future physician. These are the results for the first 3 graduating classes that we've had. When we saw the results for the second graduating class, we didn't know whether this was a trend or an outlier. We've done a lot of internal reflection and analysis of what happened between the first and the second year. And I'll just suffice it to say that we think that the second class was really an outlier, not a trend. And I think that that was borne out by the results of the third class, which comes back up again to being above national average. So again, based on the national average of graduating students across the US, our students have reported better than average for 2 out of 3 years. And I think really that second year was really an outlier. And we'll get more data every year. When you look at our residency program, we've matched very highly every year. And our categorical programs have always exceeded the national average of 95%. We did have one MyDocs position last year that went unfilled, but there were many more MyDocs positions at the other 3 participating medical schools in Michigan that participate in MyDocs. So we're very pleased with our success rate with being able to recruit really good residents to our residency programs, and including MyDocs, which will continue this next year as well. One of the ways we look at the program success is by looking at the first-time board pass rate for our graduates. Now, this is a 5-year rolling average, so it's a bit of a lagging indicator. In other words, it will be delayed in how well it gives you information into the quality of the program. You can see that using a 5-year rolling average that there is was concern about our pediatrics performance, but we've recognized this for a couple of years now, and we have taken steps to address that. And if you look at the last year, our medicine peds and pediatrics success rate on the board exam was 100% and 88% respectively. So again, those numbers are now back up above national average. Obviously, our goal is for 100% first-time pass rate for all of our graduates, and we're making. I think we're doing very well. We're doing as well as other schools, and we'll continue to strive for that 100%. And many programs are already there. And finally, for medical education, to look at the growth in continuing education, this has grown both in the number of hours and the number of individuals who are participating. You can see here the total hours of instruction. That's increased as we have gone just ACCME accreditation to joint accreditation. This is not the Joint Commission, but this is joint accreditation that involves ACCME as well as accreditation for nurses and psychologists and social workers and many other healthcare disciplines, that it really expands the parties that can participate in our continuing education and get credit. And so we do expect to see that that's going to continue to grow. I just want to emphasize how many people are involved in our educational activities. All of our faculty who all participate in some way in teaching or participating in the design and development of the curriculum, but especially our clerkship directors, course directors, the curriculum committee, which really has oversight for the medical student curriculum, and our graduate programs that are overseen by program committees. Educational affairs that supports all of our educational activities. The Graduate Medical Education Committee for that oversees with Dave Overton our residency programs. The library faculty in the medical library provide tremendous support for both undergraduate and graduate programs. Resident affairs that supports residents along with program coordinators and the residency program directors. And then student affairs that provides support for all those things that occur outside the classroom. Just tremendous levels of effort that have gone forward to help support our medical students, graduate students, and our residents, and us as continuing lifelong learners. Let me turn now to clinical care. It's been a big year for us. We've rebranded our clinical activities as WMed Health, and really trying to emphasize the cohesiveness that we have at the medical school for providing health, even though we're at different locations. We've, with that rebranding, we restructured clinical affairs leadership and have both physician leadership from Keith Kenter as the Associate Dean for Clinical Affairs, and then also from Michelle Serbinsky as the Associate Dean for Clinical Operations and Performance Improvement. And also a new position as Assistant Dean with Noreen here, who's here as the Assistant Dean in Clinical Affairs. Our laboratory services were reaccredited by the Joint Commission. We've done a lot of work this year in clinical affairs and occupational health to support employees and students through COVID. A big change, and I think this will hopefully be some elements of this that we'll be able to retain in the future, to implement telehealth as an option for providing care to the community and the patients we serve. That obviously played a key role during much of the COVID pandemic, and I do think I think this is something that will hopefully be maintained in some way in the future. We've obviously had a decline over the past few months, but also over the past few years, but we've seen the ability, we've reversed that visit decline. And so I'll show you some information about how we're getting back up with the number of visits we need to have. Another area that we've added has been ethics consults for WMed Health, as well as ethics consults at Bronson and Borges. Forensic pathology is another clinical area of the medical school. That's on the 7th floor of the downtown building. Our clinical forensic pathologists provide medical examiner services, full service to 12 counties and some service to 12 additional counties, both in Michigan and northern Indiana. So there's a lot of clinical activity that goes on in pathology. And that program was reaccredited by the National Association of Medical Examiners this year. This is the number of outpatient clinic visits at the medical school. You can see that those declined over the past 3 or 4 years, but that we're now back up in 2019, and we actually can obviously continue to track this. There was a decline with COVID, but we're still on track to get back to these levels of where we were before COVID. But this is obviously an important part of medical school, to be able to see and take care of the patients and provide opportunities for learning. When you look at another aspect of our clinical activities, this medical examinations that have been done over the past several years. Obviously, Kalamazoo County is is a large county, but also Calhoun County, where Battle Creek is. But you can see that we provide services for many counties and have consistently done that. And that number of counties is actually growing. We would expect that to increase as we provide services to 1 or 2 more counties. Again, a lot of people have been involved in this. All of our clinic staff, our clinical faculty, our clinic leadership, the clinical leadership and quality committee, and with our department chairs, lab services, occupational health, and our pathology faculty and staff. A lot of time and effort have gone into supporting our clinical activities, but this is obviously a major part of the medical school, or the clinical services that we provide to the community. Let me turn now to research as another key area of the medical school. This past year, our Human Research Protection Program was granted full accreditation from AHRP, which is the Association for Accreditation of Human Research Protection Programs. This is really the good housekeeping seal of approval of our IRB activities, and just reflects the level of quality of our oversight for human research programs. Forentox is a joint venture with Sparrow. It actually brings benefit to the medical school by being able to expand our research base, and we've had students who participated in research projects with Forentox, led by Prentice Jones, but it also gives us an opportunity to leverage some of the forensic pathology services that we provide, and to bring services to the medical school at a way that we can afford to do them, and actually have them subsidized by these other activities. This past year, we hosted the 11th Annual International Scientific Conference for Indian Global Psychiatric Initiatives, and we also were able to establish a new unit of the International Network of the UNESCO Chair in Bioethics. Several faculty participate in these activities as opportunities for scholarly activities. One way that we look at our research productivity is by the number of new grant awards each year. You can see that the number, and we divide the grants up into whether these are education grants, research grants, service, or infrastructure. We've had one infrastructure grant, which was to help with the 7th floor of the Upjohn building, which was renovated last year. You can see the number of grants has been substantially growing over the past several years, and this next year it is going to grow again. A lot of research grants that really reflect the growth of our Department of Investigative Medicine, led by Tom Rothstein, very successful faculty in getting NIH and other grants. Another way to look at our success is by the dollar amount of the grant awards. The awards are actually probably not as exact as a measure as the expenditures, which are shown in blue. The awards will show more variable up and down, whereas the expenditures will give you a more consistent picture of what's actually happening. And you can see that the amount of growth in our research dollars, both awarded and expended, has really grown over the past several years, and this is going to continue to grow this next year. Publications are really a measure of the activity that we do, the scholarly activity that we are participating in as a medical school. You can see that peer-reviewed publications, which are really the gold standard for measuring scholarly activity, have significantly grown and are very solid, just around 300 a year. That continues to grow and really does reflect a lot of breadth in our activity, both in laboratory research, clinical research, community-based research, and educational research. Solid peer-reviewed publication track record in each area. Again, a lot of folks are involved in this. Thank you to all of you. Our Center for Clinical Research, led by Tom Block, Department of Investigative Medicine, led by Tom Rothstein, Maria Diaz and her faculty and staff in epidemiology and biostatistics. We have a research histology lab. Sandra Cochran leads the Innovation Center, that continues to be very successful. Liz Lorbeer and the medical library faculty and staff supporting all of these scholarly activities. Sometimes the areas that do a lot of the work and don't get recognized, the research compliance staff with Amy Shipley, Chris Schneider, and Maureen Owens in Human Research Protection Program, Prentice Jones in our toxicology lab, the vivarium staff being able to maintain all of our activities and services even through COVID. A lot of support, a lot of time and effort going in to make all of our researchers productive. Thank you all. Our next area is community service. This is really a key part of our vision as a medical school. And this slide really goes over many of the active highlights of this past year. The CARES Clinic is a positive living clinic for HIV-infected individuals that we collaborate with to maintain and operate. We actually started this year in the early phases of COVID to provide COVID testing. Now that's available more widespread and still at the medical school, but many other sites as well. Our community sites for active citizenship continue to grow, and that's an important part of our medical student curriculum. This past year, we formed a branch of the American Medical Women's Association. We've launched the new WMed volunteer program where every employee of the medical school can participate in community activities and be able to have time to be a volunteer in the community. We've had over $800,000 in grants to support public and community health initiatives this year. Our faculty continue to play key roles in county and state health programs, including emergency medical services, especially Bill Fales, and Joyce DeYoung with medical forensic pathology, and Will Nettleton, who serves as the medical director for both Kalamazoo and Calhoun counties. And really, our faculty are playing key roles throughout the community in many ways to support community activities. Our medical students have continued to volunteer to meet the needs in the community and actually stepped in many ways to help support healthcare providers during the early phases of the COVID pandemic. When you look at one measure of our activity of community service, it's our grant funding for public and community initiatives. As I mentioned, we had over $800,000 in grant funding this year, and you can see that that really continues to grow. And when you look at peer-reviewed publications, again, a lot of our peer-reviewed publications, about a quarter of them are in, or 15% of them are in community health related fields. And so, again, really reflects that a lot of our activities are supporting our community. A lot of people involved in this. Donovan Roy is our new Assistant Dean for Diversity and Inclusiveness. Cheryl Dixon leads Health Equity and Community Affairs. Lisa Grays in Faculty Affairs. Human Resources, led by Shane McGuire. But our medical students, our residents, our staff, our wellness, we are all involved in our community service and our community activities. One of the things that we've done this year is increase the scope of Karen Horneffer-Gittner from Assistant Dean for Wellness to Assistant Dean for Culture and Wellness. And I'll talk a bit more about this in the next section. Section after this. We'll talk about economic stewardship as our fifth area. This past year, we have hired a new Associate Dean, Jack Mosser, as our Associate Dean for Fund Development and Alumni Affairs. We really have a solid strategic plan now for philanthropy and are moving forward with that. This past year has obviously created a lot of financial challenges with decreased clinical revenue, increased expenses to both deliver the curriculum and design the curriculum, and also deliver healthcare with increased costs for PPE. Instead of our usual gala this year, we had to have a different type of gala to try to support philanthropy. We did create the COVID-19 Response Fund, which has helped provide some funds to support staff and students at the medical school. This past year, we did renovate the 7th floor that created space for forensic pathology, as well as additional space for digital anatomy, but also created a new bioskills lab to support biomedical engineering and some of our training in some of the procedurally based residencies. We also introduced the Go Greener initiative this year to help reduce the ecological impact of the medical school. When you look at our revenue streams, you can see that they've been fairly steady. A large part of our support comes from the hospitals. That has grown significantly over the past 3 years. We're now in the 3rd year where that's going to be very flat. So our hospital support is flat. Tuition is now about at the level where it's going to remain at. Our endowment funding really fills in the gap for the undergraduate medical education expenses. The one area that we can grow is our clinical revenue and our grants and contracts. And so this really shows the different areas of financial support that support the medical school. Our endowment, the original endowment to the medical school, is obviously very important to us. We are drawing down about $10 to $11 million a year of our endowment. Supporting that endowment to increase that to be sustainable in perpetuity is a major focus. And I do anticipate that over the next few months that we'll be able to make some significant announcements about the endowment and about how that's going to be able to be sustainable beyond just the current 10 years of sustainability. When you look at our other contributions and gifts to the medical school, you can see that that really has increased, and that in many ways is thanks to all of you who participate in the We Make WMed campaign and the annual employee giving campaign. This is really an important part of the medical school, to be able to develop programs and to be able to show that the medical school faculty and staff are in fact supporting the medical school themselves. So thank you for helping to make this happen. When you look at the total number of donors this past year, 300 total donors with over 2,000 gifts received with a value of $2.7 million. Some of those are in-kind gifts, some of those are planned gifts, some of those are businesses that have given. But again, you can see the breadth of giving to the medical school over this past year. So thank you to all the faculty and staff who participated in giving to the medical school, those who help support our economic and financial offices, from accounting, communications, development, facilities, IT, and the Office of the Dean, especially Karen Woodley. So I mentioned that we had placed an increased emphasis on culture this year. We've made a lot of changes. Remember, we conducted a pulse survey in June that was led by an external consultant, and as a result of that, we've created the role of Assistant Dean for Culture and Wellness, and with Karen Horneffer-Gittner in that role. Donovan Roy has joined us as our Assistant Dean for Diversity and Inclusiveness. Some of the things that we've done this year, We've had a position statement on racial inequality. I think that's an important part of this medical school. The advocacy that we talked about as part of the CLEAR acronym and in the mission of the medical school really is that advocacy that we need to have as a school and as individuals in the community. But a lot of activity this year in culture, and especially reinvigorating the culture committee to be able to take the leadership on culture as one of our 6 strategic areas. We also created the role of an ombudsperson, and we now have Jean Volheis in that role, who's working with Karen Horneffer-Gittner, Human Resources, in that role and Student Affairs in that role as ombudsperson. Thank you to all of you that have been the advocates at the medical school and in our community for the things that are important to all of us. Advocacy for diversity and inclusiveness, advocacy for health equity, advocacy for community engagement, and advocacy for making sure that we pay attention to wellness of ourselves, but each other. So thank you for all that you have done to help contribute to that culture. So that is a summary of the medical school. It's a whirlwind tour of where we are in our 6 strategic areas. And so I want to really take the opportunity to thank all of you who've really done all of the work that has made all of this possible. And you know, the medical school is kind of a collective noun fallacy. The medical school is not a thing. The medical school is really all of you, and you're the ones who do the work of the medical school and who really make sure that we're meeting the mission that we set out to do. So with that, I would be glad to take any questions. I'll let Karen moderate if there's questions that come up in the chat. But I'd be glad to take any questions from any of you about any aspect of the medical school. Kind of a quiet group. I see one hand up.
Jocelyn DeLeon.
Oh no, I accidentally clicked that. I don't have any questions, sorry.
Okay.
Someone asked what the COVID vaccination plans are for WMed.
As many of you know, the FDA is meeting today, and I expect we'll grant emergency use authorization for the COVID vaccine. And there's a second vaccine coming along next week, and other vaccines that are also in the pipeline. Our plan is to vaccinate as soon and as many as we can. The vaccine will not be a requirement of employment or enrollment, but we are advocating that everybody who is appropriate to get the vaccine. The only contraindications might be if you've had a serious allergic reaction in the past, that we would hope that everybody would want to get the vaccine. The vaccine is going to become available next week. We anticipate that it's going to be available first at the hospitals. We are not a hospital or health system, and so therefore will be not in the first row of institutions that get the vaccine. We are collaborating with the county health department, with our 2 hospital partners, Family Health Center as well, in being able to provide access to the vaccine for our healthcare providers, our residents, our medical students who are at those sites. So they are collaborating and offering to immunize our individuals who are at Bronson, at Borges, at the Family Health Center, to be able to immunize them on site there with the vaccine that they received. And that, I think, will help get many of us vaccinated. We will get vaccine for the medical school. For those who work at Oakland, at Mall Drive and other sites, we'll get that vaccine, I think, within the next week or 2. As soon as we get that vaccine, we'll let you know what the plans will be, but we anticipate vaccinating as soon and as many as we can. We have not received the information yet, but we will share the information, the vaccination information that you'll need to know and understand before you get vaccinated. We will share that as soon as that's publicly available, and make sure you have that so you can read that and consider that before you show up to be vaccinated. We are, the rapid response team, especially clinical affairs, and Michelle Serbinsky are working very hard on making sure that we have provide access to the vaccine as quickly as we can.
Another question was, are you concerned about the reductions in clinical rotations for the med students impacting their educational preparedness for residency?
It's something that we pay attention to. There is concern. There's concern by a lot of individuals at the medical school and in the profession about the impact of this on learners, about the impact on medical students and on the impact on residents who are going through training. So we have looked at it, and at least by one or two measures, we feel confident that we continue to do a good job as a medical school. Mike Boucher in Educational Affairs has looked at the performance of our students on our internal exams and also the performance on our external STEP exams. How well have the students who've been affected by COVID performed compared to previous years? And the data so far is that the students are continuing to perform at or above previous years. So we don't see any reduction in their learning. We do worry about, the impact of some of the other aspects of an educational experience with being able to participate in the care of patients, exposure to a number of different clinical settings and patients, and being able to get that clinical experience. I worry about the reduction perhaps in the number of surgeries, say, that some of our residents have been able to participate in because of the reduced number of elective surgeries. So there are all kinds of concerns. We haven't seen an impact yet. Will it have an impact? It's likely to have some impact. Will it have a substantive impact? We just don't know yet. We haven't seen evidence that gives me cause for concern that our students are going to be less prepared, our residents are going to be less prepared. But it is a concern that removing students from clinical activities for a couple of months because of PPE shortages, reduced numbers of surgeries and other procedures, reduced number of visits does reduce the experience. And that's how we learn, is by taking care of patients. So time will tell. I think there will be opportunities to make up any gaps though.
Another question was, what are the biggest financial challenges for WMed going forward?
Well, that's obviously a huge concern, not just for the medical school, but for many, if not most medical schools, and also for many, if not most hospitals and health systems. Over the past few months, we have really prioritized keeping positions and payrolls intact. And I think we've succeeded, and I think we've done very well in being able to maintain keeping positions and payrolls intact. We had a few staff who chose to go on voluntary furlough, but that was partly because we didn't have the need here, and financially it was to their benefit to be able to go on the furlough because of the provisions by the CARES Act. All of those individuals came back shortly after as the volume started to pick up in the clinic. But if you take a look at what the impact has been at other medical schools and other hospitals, we have been far less impacted. For example, many medical schools, physicians, faculty have taken a significant reduction, 10, and in some departments even 20%. Now that may have only been for 3 or 4 or 5 months, but that's a significant salary reduction. In many institutions, including some here in town, the employees took a reduction in retirement benefits. That has an impact that lasts for a long time through your retirement when you plan less for retirement. So I think this next year is going to be a very difficult year. It's going to be a very difficult year for any state-supported institution, but it's going to also be a difficult year for any private institution, which we are. I expect we'll continue to have the same number of students and the same amount of tuition. I expect that we will have the same amount of an increased number of grant support and contract support. I expect that we'll have the same or increased amount of philanthropic support, including what I expect will be a major gift announcements to help support the medical school for the next 10 years. And I expect that our clinical volume will increase. I do expect that even though our clinical volume will increase, that the government reimbursement may change and may not be as good on a per case basis as it is now. So this is going to be a very trying year or two at the state level and at the federal level, and those will have some impact on us. I think, have been very good stewards of the funds provided by the hospitals and through the endowment. And I think we've been judicious. I think we've been careful. I think we've been, I wouldn't say cheap, but I would say we've been frugal. And I think we've been good stewards of those funds. And that's by design. And I think that warrants faith that we'll continue to be good stewards and be able to succeed in the future. And so I'm cautiously optimistic that we'll be able to continue and to grow in the future. But I do think it's going to be trying times for us as a country and as a profession.
That's all the questions I see. I don't see any hands up, so.
Well, I want to thank you all again. You really are what makes the medical school succeed, and really are what makes what we do rewarding. So thank you for your part in this, and you should be very pleased with how well I think the medical school has done this past year in spite of COVID, and be very optimistic about the future of the medical school. So thank you again, and have a great week.